Hello and welcome to my little exercise video. Today I'm going to go through some Pilates style exercises which are brilliant if you suffer from Ankylosing spondylitis or Axial Spondyloarthritis. Before you take part in the exercise routine, please make sure that you have consulted with a healthcare professional or your consultant so that you've got the all clear to take part in this exercise program. Right, to begin with, we're going to work on our setup. So what I want you to do is bring your feet all the way together so that they're touching each other. Then bring your weight onto your heels, bring the toes out, then the weight onto the toes, and bring your heels out. So your feet should be about hip distance apart. Have a bit of a bend in your knees, don't lock out your knees, hands on the hips, and the first thing that I want you to do is bring your pelvis forwards and backwards. It's just like a little tilt in the pelvis, forwards and backwards. Start with small movements and then you can make the movements bigger and bigger and bigger. I'm going to show you from the side as well what it looks like. So we have our good stance, hands on the hips, pelvis forwards, pelvis backwards, pelvis forwards, pelvis backwards. So make sure that the movement is coming from the lower part of your spine, so right from the bottom, rather than your lumbar spine or anything higher up. You don't need to make big movements, and I don't want you to be uncomfortable. So only move as much as you can and as much as you're comfortable with. It really nicely mobilizes your pelvis. Once you've got the maximum movement, you're going to make the movement smaller and smaller and smaller again until you've stopped in the middle. And the middle is your neutral pelvis. So that's the position your pelvis is at its strongest. So you have to practice that a little bit because your pelvis should be in that position whenever you do anything, not just for these exercises, but also when you stand up of a chair, if you get on the floor, your pelvis should be in this position, but you need to get a feeling for that. So doing this exercise every day can help you to find your neutral pelvis. The next thing I want you to do is focus on engaging your core musculature. So focus onto your abdominals, especially your belly button. And what you're trying to do is you're trying to draw in your belly button. There's no movement in the spine. It's just you trying to pull in the belly button bit by bit by bit. Initially, you should feel the tension more at the front, but as you draw it in further, you should feel more tension around the side, maybe even in the lower back. And just draw it in step by step. Ideally, you want to do 10 pulls, but if you're struggling, you do as many as you can until you've got your maximum. Make sure that you breathe normally into your chest, don't breathe into your the tummy, till you've got your maximum, and just hold that maximum tension for just a few seconds. Make sure that your pelvis is still in the same position, that your knees are still bent, just the tension in here, and then you just let go. Lovely. And now you focus onto your pelvic floor muscles. So you need to lift your pelvic floor muscle. Same thing as with your abdominal musculature, you lift your pelvic floor musculature bit by bit by bit. Again, 10 times if you can. Make sure that you don't let go in between. Just lift it up as much as you can. Perfect. And once you've got your maximum, you give everything a squeeze, the pelvic floor musculature as well as the abdominal musculature. And just hold that for a few seconds. Lovely. And then let go. And for the exercise, I would like you to have just a little bit of tension in the pelvic floor muscles as well as the abdominals. So about 30% in the tummy, 30% in the pelvic floor. If you forget, don't worry, it's all about practice. The next thing I want to work on is our mobility in the lower back and in the lumbar spine. So I want to work a little bit on our side to side movement. So we are in our pelvic neutral position, knees are bent, abdominals are slightly engaged, and so are the pelvic floor muscles. You take a deep breath in, and you just lean onto your side. Just let your arm run down the side of your leg. You take a deep breath in and come back to the center, and breathe out to the other side. And then you breathe in, and you breathe out. It's not about how far you can go to the side. It's more important that you've got about the same distance on either side. Just gently lean into the stretch and make sure that your pelvis doesn't move. So my pelvis doesn't sway from side to side, it stays in the same position. So all the movement comes from the lower back. Breathe out when you go to the side. Breathe in when you come to the center. Try to keep the tension in the abdominals and tension in the pelvic floor. When you go to the side, you could try and give your abdominals just a bit more of a squeeze. But if that's too much, then that's too much for you. Make sure that your neck doesn't tilt, it's just an elongation of your spine. Perfect. Just do it once more to one side. And then once more to the other side. Brilliant. Right, the next thing we want to do now is work on our roll down. So roll down means that we're moving from a standing position down to the floor. Again, go as far as you're comfortable with. You don't need to get your hands on the floor. That's not what this is about. This is about mobility. So if you can go just a little bit further than you can normally go, then that is fine, okay? What we're doing is, I'll show you from the side, is we go back into a normal position. So feet hip distance apart, pelvis is tucked, so we're halfway between the neutral pelvis. We engage our abdominals, we engage our pelvic floor, we take a deep breath in, and when we breathe out, we bring our chin to our chest, and just relax it. And then you let our arms drop. You try to bring the weight onto the ball of our feet, and then step by step by step, you're going to stretch out the spine. Again, take your time. You can breathe normally, but you just try to stretch out the bit, as if every single vertebra is being pulled. And you go as far down as you can until you've reached your maximum. And you stay there for a few seconds. You keep your belly button drawn in, and you take another deep breath in. And when you breathe back out, you move back up with it. If you were restacking your spine, vertebra by vertebra, you're going to go and come back up. Take your time, and we do that 2 more times. Definitely, until we're back up. Wait until you're all the way straight, so everything is back in the normal position, and then again, deep breath in, and all the way out, chin to chest, shoulders forwards, and we go down. Lovely. And maybe you're able to go just a little bit further this time. And if not, then that isn't a problem, as long as you can feel the stretch. Deep breath in, and all the way out. Perfect. And then when we do our next one, we're only going to go down, and then we go onto our mat. Deep breath in, all the way out. Lovely. If you want, you could hold for a few seconds, but it's up to you. And then you can bend your knees, and we're going to come down onto our mat, and we're going to lie onto our side. Stretch out the arm above your head to rest your head on your arm. If you're struggling with your shoulder, what you can do is bring the arm forward, grab a pillow, and prop a pillow underneath your head. If you're struggling with your hip, or you struggle to lie on your hip, you can also get a little cushion or a blanket and prop it underneath. So, head rests on the arm. Knees are bent, and they are on top of each other, and so are the feet, as you can see here, and also the pelvis. You try and bring the pelvis back into neutral position. So we do the same thing that we did last time. We do a couple of pelvic tilts, so you know which direction the pelvis wants to move, and then you're going to stop right in the middle to bring the pelvis back into neutral position. Engage your core musculature, draw in your belly button, and lift up your pelvic floor. The top hand is gently put on the fingertips in front of us, because you don't want to lean onto the hand. You take a deep breath in, and when you breathe out, you rotate the hip, the top leg, to bring the leg up. And when you breathe in, you bring it back down. And again, deep breath out, and breathe in again. Make sure that the only joint that moves is your hip joint here. You want to avoid moving your actual pelvis. You don't want to lean forwards when you do the exercise. You don't want to fall backwards. Everything is in a neutral position. It's just the hip that comes up and down. This is quite a difficult exercise if you have weakness in your pelvis, and you might feel a little bit of cramping in your outer buttocks. But it's important to strengthen your buttocks musculature, especially if you have problems with your spine or your pelvic joint. And it doesn't matter how many you can do, it's important that you do a few every day. Lovely. Let's do 2 more, and then I think we've had enough. Just up there. Perfect. And then the last one. There we go. And we go back into neutral. Lovely. And we do the same thing on the other side. There we go. Same principle. Stretch out your top arm, or use a pillow if that's better for you. Bend your knees. Feet on top of each other. Pelvis in neutral position. You can do a few tilts to find the middle. Engage your core musculature. Lift up your pelvic floor. Our front hand is gently put onto the mat. You take a deep breath in, and all the way out, and we lift up and come down, and lift up again, and bring down the leg. Perfect. And again, same idea. Don't move your pelvis, it's just the hip that comes up. And again, you might feel a little bit of cramping in the outer buttocks. You might also notice a difference from side to side. Maybe you've got a weaker side and a stronger side. Then you know which side to focus on to work a little bit on your strength. Lovely. Well done. Try to keep the tension in your abdominals and try to lift up your pelvic floor if you can. If that's too much for you at the moment, you just go through the exercise routine. The most important thing is that your pelvis remains in neutral. So if you're keeping your pelvis in this position, you're not rocking backwards or forwards, you're doing a great job. Lovely. Just one more. And breathe out. And breathe in. Lovely, well done. And we go onto our backs. Next exercise that we're going to do is a glute bridge, which is an exercise you've probably done before. It's a very common exercise for people with low back pain, whether it's inflammatory or mechanical. So you lie onto your backs and your legs are again sort of hip distance apart, and knees, ankles, everything are in line. Don't have your feet too close to your bum because that's going to make it really difficult. If you think you're too close, it's better to have a bit of a bigger gap between the knees. And now we try and find our pelvic neutral again. So bring your hand onto your pelvis, into the bony bits of the pelvis, and you bring the pelvis in again, and you bring it out. And you tilt it inwards, and you tilt it outwards. The same thing that we did when we stood upright. And then you make the movement smaller, and smaller, and smaller. So you're back into your neutral pelvis. Like I said at the beginning, it takes a while to find that neutral pelvis. So if you're struggling at the moment, don't worry, you'll eventually get a feeling for it. So once you've got the middle point, you keep it right there. Lovely, well done. You draw in your belly button and you lift your pelvic floor. Your hands are at the side. You take a deep breath in, and when you breathe out, you clench your bum muscles really, really tight, and then you gently peel your back off the mat and you go up into the bridge position. Make sure that your bum muscles are tight the whole time. If you lose the tension, you lose all the stability in your core musculature. Once you've reached your top bit, you take a deep breath in again, you breathe out, and you're gently going to come down. You don't need to hold a bridge. That isn't important. It's about engaging the right muscles. And when you're down, you take a deep breath in again, clench your bum muscles, and peel your back away from the mat and bring yourself up into the bridge position. If you're struggling to get all the way to the top, then don't worry. You can just go halfway. That still engages your core musculature. The most important thing is that you keep your bum muscles clenched and that you feel the engagement in your abdominals and your tummy muscles. Take your time and come back down. Well done. So, we're gonna do one more. Clench your bum muscles. Go all the way to the top. Perfect. There you go. And all the way down. Really nice. Good. So, the last thing we're going to do is just 1 or 2 little stretches to make sure that you stretch out your muscles before you start with the exercise routine. So what you want to do now is bring your legs all the way together. So now your knees are touching each other, your ankles are touching each other. You bring your arms out to either side, and then you take a deep breath in. And when you breathe out, you gently let your knees drop to the side and you look the opposite way. It's not important how far you can go. It's important that you feel a bit of a stretch. And then you take a deep breath in, you come to the center, and you breathe all the way out, you go to the other side. And again, breathe all the way in, and breathe out, and go the opposite way, and breathe in, and breathe out, and go the opposite way. Perfect. And come back to the center. Now I want you to stretch out both legs, and then you're going to grab one knee and you bring the knee towards your chest. Again, it doesn't matter how far you can get your knee towards your chest. It's important that you feel the stretch in your back and in your buttocks. Perfect. You're going to let go, grab the other one, and stretch your knee towards your chest. Lovely. Well done. If you want to, you can also use both legs and stretch them together, but if that's too much, don't worry. Again, just do one leg at a time, and that is good enough. Good. Lovely. Once you've done that, you're going to come up, and you can either stretch out your legs in front of you, or you can sit with your legs crossed, whatever you prefer. I normally like to stretch out my legs in front of me, and all I want you to do is just circle your shoulders a little bit forwards a few times, and then backwards a few times, just to mobilize the shoulders. Lovely. And then bring one arm in front of your chest, and just stretch it out a little bit. Well done. And in front of the other side. Good, well done. Once more on the first side. Perfect. And then once more on the other side. Lovely. Well done. I hope you enjoyed the little exercise routine, and if you've got any other questions, always feel free to contact me and ask me about some of the exercises. Lovely. Thank you.